Now, I'm honored to introduce today's opening session, which will display the vital importance of including people with lived experience in the work we are all pursuing. As advocates, policymakers, healthcare providers, and more, the experience of those impacted by our actions is too often ignored or forgotten. However, for people who use drugs and for those in recovery, this exclusion can be an incredibly intimate experience. Hearing the stories of those with lived experience is vital. I am happy to present today's panelists, all three of which are incredibly accomplished women with lived experience, and now I'll introduce the moderator for today's session, First Lady Burgum. Catherine Burgum became First Lady in 2016 when her husband, Governor Doug Burgum, was sworn in as the 33rd governor of North Dakota. As First Lady, Catherine's priority is supporting and developing initiatives to eliminate the shame and stigma of the chronic disease of addiction in North Dakota. In long-term recovery for 19 years, she shares her personal experience and encourages others to do the same to help normalize the conversation around the disease of addiction. Catherine plays an active role in supporting the Office of Recovery Reinvented as the chair of their advisory council. First Lady, welcome, and I'll leave the conversation to you.
Thank you. Thank you so much, Matthew, for that kind introduction and for all the hard work that you and the other organizing committee members have put into making the summit a reality. And thank you to the over 4,000 of you, wherever you are, wherever you're watching from today, for making the stigma of addiction a priority and for engaging, learning, and discovering the ways in which you can make a difference. At this time, I'd like to introduce the other panel members. I'm thrilled to introduce the first panelist of the session, Melissa Anderson. In meeting Melissa, I quickly understood that she is a powerful voice for ending stigma who is rooted in humility and empathy. Quipping that the credentials behind her name are the result of way too much formal education, she embodies what it means to be an advocate because she has walked the road through addiction and recovery herself. As the Director of Public Policy and Advocacy for BrightView Health, she brings a unique perspective of understanding addiction treatment as a payer, provider, and a patient, and has had an all too intimate view of how persuasive stigma can be in healthcare, especially in a healthcare setting. Please help me welcome this inspiring face and voice of recovery, Melissa.
Thank you, First Lady Burgum. It was a all too kind introduction. I am thrilled to be here today with everyone on the all of the panelists and then all of the registrants. I think stigma is the most pervasive and the most threatening issue facing the addiction, turning the addiction epidemic around and actually becoming successful in helping others into recovery.
Thank you, Melissa. Next, I'd like to introduce our next panelist, Lori Johnson-Wade. When you have the opportunity to connect with Lori, the first thing you come to recognize and appreciate is her infectious spirit for change. Lori is a woman in long-term recovery for over 30 years and a passionate builder of recovery communities. She co-founded her own recovery community organization, Lost Dreams Awakening, in New Kensington, Pennsylvania. Lori is a much sought after advocate in the field, being named the Pittsburgh Recovery Advocate of the Year in 2020, serving on the National Faces and Voices of Recovery Board, and serving on state committees with the Pennsylvania Department of Drug and Alcohol Programs. She's a big believer in using your lived experience as a peer support specialist to eliminate stigma and help others in their recovery journeys. Let's welcome Lori.
Thank you, First Lady Burgum. That is such a wonderful introduction, and also to my colleague and peer here, Dr. Anderson. I want to thank NAM, Dale Medical School, and Shatterproof for the honor to participate on this panel and talk about this very important issue and the personal impact of stigma. Thank you so much.
Well, before I'm going to ask both you and Lori and Melissa to give us like a 5-minute overview of your kind of your background and why this issue is important to you. But before I get started, I just wanted to say a couple of things. When I became the First Lady of North Dakota 4 years ago, can't believe it's 4 years ago now, I said right away that I wanted to shape my platform around eliminating the shame and stigma that surrounds the disease of addiction. I think for many people, they were confused why a First Lady would choose such a topic when others had tackled things like children's literacy, food insecurity, and a host of other worthy topics. When I did my first, it wasn't until my first interview as First Lady that I basically shed some light on why this topic was so important to me. The reporter looked at me and said, "Addiction, that's an interesting initiative for a First Lady. Why are you so passionate about this?" I took a deep breath, and with a quiet assurance that I was doing this for the right reasons, and just maybe my story could help one person, I said, "I'm very passionate about addiction because it affects me personally. I've been in recovery from alcohol addiction for 15 years. At that moment, I felt like a 100-pound weight had been lifted off my shoulders. My struggles with addiction and joys of recovery had been a secret to most everyone outside of my closest friends and family. 15 years of silence, of shame, of wondering if I could ever talk publicly about this had basically disappeared into thin air. Today, I'm grateful to speak to you all as a person of over 19 years of recovery, and I have been actively working on this issue of stigma for the past 4 years in my role as First Lady. Wherever I go across the state or around the country, I always maintain the belief that storytelling ends stigma. Stories create connection, help us understand that we are not alone, and encourage others to reach out for help. So I model this by sharing my own story. I started drinking in high school as a way to cope with anxiety and social pressures that I faced every day. I experienced my first blackout when I was in high school, which led to a long road of 22 years of blackouts, embarrassing drunk episodes, and hopelessness. I battled through a cycle of relapse for over 8 years and finally was able to find a sustained recovery because I was completely willing to do whatever it would take. And I had the courage to reach out to help from my team leader at work, of all places. Her compassion is basically her compassion and understanding and support was one of the most pivotal catalysts to my recovery journey. I could never have imagined that telling my story publicly would have opened so many doors. It started a statewide movement in North Dakota called Recovery Reinvented, where we reach thousands annually through an inspiring one-day event. We have launched stigma-ending initiatives in schools and in the workplace. And we've hosted a Shark Tank-like recovery innovation competition. We empower people to reach out for help and connect to resources. And we launched one of the first statewide stigma surveys in the nation to understand the baseline of stigma in our state. Stigma is one of the most challenging barriers to seeking recovery, seeking help and finding recovery. So as we move throughout today, I challenge all of you to think about where you see stigma and how you can help normalize the conversations around addiction by sharing your own stories and experiences. Now, I'd like to ask Melissa to give us a little bit of information about your background and why you're here, why this topic is important to you.
Absolutely. My name is Melissa Anderson. I am a girl that grew up in rural Eastern Kentucky. I try to tuck in my accent, but it will sneak out from time to time. My journey, I've always worked in the healthcare setting. Started out working as a clinical pharmacist in a children's hospital. in Lexington, Kentucky. Decided I wanted to dive a little deeper. So while working as a pharmacist, I completed medical school and began an anesthesia residency. In my anesthesia residency, there were a lot of external factors that contributed to me the first consumption of opioids and then developing an addiction that I tried multiple times myself. I tried to treat myself because I knew what seeking help would mean. And when I finally did seek help, as a physician, your options are very limited. You're told where you can go and how long you will be there. MAT or other forms of evidence-based care is not an option. So I completed my 4 months of non-evidence-based treatment, came back, jumped through all the hoops, whistles, was not allowed to interact, obviously, back into an anesthesia residency. That probably would not have been, I can see it now, that would have not been the best setting for me. However, it was devastating at the time. So I decided, I want to do something. I want to make others' pathway a little smoother. If I can do anything to prevent others from walking the path, or if they have to make it a more direct and more evidence-based path. So I worked in the industry developing medications for opioid use disorder and did that for 5 years, and recently stepped in. I fell in love with interacting with payers, public policy, because you can have the best treatments, but if they're not accessible, they're not affordable, if they're not reimbursed, it never makes its way to the patients. I want addiction care to look like any other field of medicine, where you have research. Research drives evidence-based policy, and those policies are reinforced by payer reimbursement and checks and balances. Unfortunately, that's still not the case. So I joined BrightView Health, which is based in Cincinnati, Ohio, in March. And now I am the Director of Public Policy and Advocacy. I can speak openly about my personal lived experience. It's the first time I've been able, that's actually been a positive, which when you're a patient, that's the voice you need to hear. That's the voice you want to hear. You don't want what someone's read in a book. You need someone that says, hey, I've been there. I know what you're feeling, and I am living testament that you can get past this as well. So this is my first opportunity to do that. Working with payers, working with state, federal officials to drive policy and make sure that patients are treated with dignity, respect, and have access to all forms of evidence-based care.
Okay. Well, thank you so much, Melissa, for sharing your information. And it's so important that you're part of the conversation today. Lori, would you like to share a bit about yourself and why this topic is important to you?
Sure. Thank you, Catherine. And thank you, Melissa, for sharing that. It takes great courage to come out of the shadows, come out of the closet, and live your recovery out loud. That's one of the mantras that I believe in, that I recover out loud. I put a face and a voice to my recovery. In my 20s, I had suffered a loss that emotionally I could not navigate. It was a traumatic experience for me. And so I had sought to self-medicate and with opioid stimulants. And what occurred out of that is it led me into the criminal justice system, because when you do that on a regular basis, it becomes a hefty task. And so, and it's an ugly taskmaster. Addiction's an ugly taskmaster. And so I was introduced to the concept of treatment through the criminal justice system, given a diversion opportunity that I took, and I went to treatment. And what I know is that treatment works. Prevention, treatment, and recovery, they work. And when I got to treatment, I heard something that changed the trajectory of my life, that you have a disease called addiction, that it's a treatable disease, that you're sick, not bad. And it was like the heavens opened up and the hallelujah choir sang. I said, oh my goodness, there's hope for me. And so then I just took that and I ran with it. And not only me, but my husband is also in recovery. And so together we co-founded a recovery community organization as a direct amends to our community, as a way to be a light to our community, because if we could recover, anybody could recover. And so we started a recovery community organization using the gold standard of the Association of Recovery Community Organizations, Faces and Voices of Recovery. And we wanted to start something that our community could benefit from. So we started a 501c3 nonprofit where our mission was to promote the right and resources to recover through advocacy, education, and demonstrating the power and proof of long-term recovery. We envisioned a world where recovery was understood, promoted, embraced, and enjoyed, and where everybody seeking recovery could have access to support, to care, and the resources needed for long-term recovery. And so we had this kind of Pollyannish view of what things would be like, not taking into account that everybody was not going to be as happy as we were, and that stigma was going to be one of the things that we would overcome. But I'm going to tell you that living proof is a stigma buster. Let me see, I have First Lady Catherine Burgum on here, and Dr. Melissa Anderson, and Laurie Johnson Wade, and they told me in treatment, you are the least likely to recover. Black woman, you are the least likely to recover. And I said, not so. I'm going to do this thing. And so I am so excited to be here sharing the reality that we can and we do recover, that we have value, and that stigma needs to be put outside of the house. Thank you.
I am with you. Yes, put out of the house, right? Yeah, no more stigma. Thank you so much, Lori, for that awesome information and for all that you do. I think I'd like to start and send the first question to Melissa. Melissa, one of the core services that BrightView delivers and is a big advocate for is the use of medication-assisted treatment, or MAT, to treat opioid use disorder. For many of us in the camp of recovery advocacy, we view MAT as necessary and a useful tool to provide support and treatment for those who are struggling. But in many places, including our own state, North Dakota, there was initial pushback for MAT and a misinformed belief that it enables substance users by simply substituting one drug for another. Has BrightView had to work to combat stigma associated with MAT? In what ways have you worked to educate the communities that propagate stigma toward this type of treatment?
Stigma, absolutely. We've had to work diligently and continuously. I believe stigma is evident in policy. It's evident in our community. It's evident at the payer level. It's evident the fact that legislators produce that first level of clinical treatment paradigm. You know, at BrightView, we treat opioid use disorder, but we also treat alcohol use disorder, like any form of substance use disorder. So we have patients from multiple avenues coming into our doors. And when they come into, we offer abstinence-based, we offer medication-assisted with agonist pharmacotherapies, such as buprenorphine or methadone. And then we also offer the antagonist pharmacotherapy, Vivitrol. We do not force one pathway on any of our patients. We basically present them with all pathways and allow them in the decision-making process for their own recovery. I think if you want to see success, it can't be forced. No one can be forced into recovery. They have to be an active participant in given that respect to do so. So, I think that just having that approach, having all pathways approach, and then we continuously participate in state and federal, federal meetings, federal advocacy outreach. Our leadership and different members of our team are always participating in every opportunity to speak to our mission, to speak to what we do, and to speak against stigma.
Great. Thank you. Thank you so much, Melissa. Next, Lori, I'd like to ask you a question. Lost Dreams Awakening utilizes recovery coaches and peer support specialists in the services that you provide. This is something that we find crucial in North Dakota because our state is 50% rural, and we're never going to have all the resources and services we need to help all those people that need treatment and services. But peers with lived experience and addiction, and with addiction and mental illness, can be amazing resources in helping people find recovery. How have peers transformed the work within LDA? I'll shorten the Lost Dreams Awakening to LDA. And how does the shared bond of experiencing the disease of addiction reduce the stigma of the person who is seeking their pathway to recovery?
Okay, Catherine, one of the critical roles that peers play is providing a therapeutic value to one person with lived experience helping another. And I need to tell you, that's still unmatched. In one of the recovery pathways, there's a saying that the therapeutic value of one addict helping another is without parallel. And I can tell you that is true. That is appropriate at every level of the recovery-oriented system of care, starting at the emergency room. So one of the places, if somebody's at the emergency room and has experienced an overdose, and there is a peer there, if you have that peer go and speak to that person, the likelihood of them going to treatment, accessing the treatment that they need, is elevated terrifically because you can speak in their language through your experience. I've been where you're at. I know what you're going through. This is something that you need to consider at this juncture, or you may not survive the next one. And while a physician or a nurse or some other paraprofessional could speak to that, not with the authority that a person who's experienced it can, because there's a transference that takes place when you know that I know what you're going through. And what I would like to say is that I would like to see systems within the recovery-oriented system of care. I would like to see professionals use peers more. They are a tool in your hand that can help the person fulfill their treatment plan, that can help a person take your directives in terms of prescriptives. So those are people that are walking with you along the way that make you feel safe, you believe them, and it just cannot be spoken of enough. And I think one of the things that I'm going to advocate for is compensation along with that. You know, I would like the people that I work with day to day to view the value of peer support as important as any other part of the system of care.
Thank you so much, Lori. Such great wise words of wisdom. Back to you, Melissa. You mentioned a little while ago, you talked about multiple pathways to recovery. In North Dakota, I have the privilege of collaborating with one of the most innovative, who I believe, one of the most innovative state behavioral health teams in the country, who continually find evidence-based practices to implement in our communities, and most importantly, maintain committed to the belief that there are multiple pathways to recovery. One of the things that stood out to me about BrightView is their commitment to personalize recovery plans for the individuals they serve. How does BrightView carry out that personality or philosophy that there are multiple pathways to recovery? And do you find this helps reduce stigma by not forcing clients into one specific treatment plan over another?
I think first and foremost, we meet people where they are. We work hand in hand with our criminal justice system, with the probation and parole officers. We work in the emergency rooms through peer, and we employ peer support members in all of those avenues. Basically meeting people where they are and then treating them with respect. Presenting them, this is what you're struggling with, this is something that can be treated. Present all the options on the table. And then the clinician and the patient make that decision together, instead of it being a punitive or a paternalistic approach forced upon them. As humans, none of us would like that. None of us would succeed in that type of model. So I think just by meeting people where they are, giving them all the options, allowing them to participate in that choice, that empowers the patient from the beginning. And I think it reduces maybe the stigma in the recovery community. The more times, more examples we can show of people recovering in different pathways, maybe there'll be it'll be a different atmosphere. The recovery community sometimes can be the most stigmatizing, unfortunately, because there's still a belief that if this is how I recovered, this is the only way. So I think the more times we can show success in multiple pathways, it will reduce that stigma.
Absolutely. Sounds great. So one of my, let's see, I'll toss this over to Lori, this next question. One of my closest mentors is William Moyers of Hazel and Betty Ford Foundation. And he always challenges people, and he says that storytelling will help eliminate the stigma of addiction, which I strongly believe, and that is why I tell my story and ask others to do the same and be a face and voice of recovery. But he also says we need to celebrate the success stories of recovery wherever we can. And one of the creative ways that I've tried to do this in my own advocacy is through this Recovery Reinvented event. We create an opportunity to stand publicly at that event and be recognized for their recovery if they're comfortable doing so. I've also done this at business events like the Chamber of Commerce, or I also asked people at an Amazon Web Services event to stand if they were in recovery. What are some of the creative and intentional ways that we can celebrate the successes of recovery to help eliminate this stigma and normalize being proud and excited to share that we are people in recovery?
Okay, thank you, Catherine, for that question. And one of the ways that I think is the most inclusive way to celebrate recovery, and one of the things we like at Lost Dreams Awakening is we do a lot of celebrating. We celebrate every milestone that a person makes. We celebrate the fact that they got out of treatment or that they went to treatment. We celebrate the fact that they've reached 1 day or 30 days, whatever it is, that they went to their medical appointment, that they got their children back, that they got off parole or probation, or that they got a college degree. My husband obtained a PhD. I mean, my word, we were running around like chickens with our heads cut off, and to think that somebody could do such a thing. And he will have 30 years in recovery. So we celebrate at every opportunity, but when we can collectively celebrate, I love National Recovery Month. And this year's 2021 theme is Recovery is for Everyone. I love that because it's inclusive. The more you do that, the more you participate in recovery walks, the more you get your representatives involved in these type of events where they can come and celebrate with you. It's a collective effort. And I agree wholeheartedly with Melissa to make it a culture. The more pathways, the more ways we recover, the more it's in our general society and it's celebrated. I can be in a room where nobody else is in recovery but me, and I'll say, I'm celebrating 30 years in recovery, and everybody will start clapping. So it's a natural response. I think it's in all of us to celebrate one another. So I hope that that's the greatest stigma buster, living proof. There's nothing else to say. Put a period right there. Living proof. That's the stigma buster.
Absolutely. I completely agree. So Melissa, I'll ask this next question of you, and I'm going to give a little bit of an intro to it. In North Dakota, we often talk about that the disease of addiction does not discriminate, as we all know. It is one of the most inclusive diseases, impacting people across every gender, ethnicity, and tax bracket. It also affects people of every age range, particularly the youth of our nation. One initiative we created in our state was called Youth Ending Stigma, and it was a challenge. It was otherwise known as the Yes Challenge. Through this, we granted 17 middle and high school groups across the state $1,000 if they could lead a student-driven initiative to help eliminate stigma in their school and in their community. I get emotional thinking about it because it was such a cool thing. We saw everything from resource fairs, a school website built to provide comprehensive support for students, and a powerful video that I was actually able to get to the Surgeon General, the US Surgeon General, which he thought was awesome. So what role do you see youth playing in eliminating stigma? And what are the ways that parents, educators, and community members can empower the next generation to be leaders eliminating stigma?
I believe we have to begin where the exposure, where that first substance use and problematic substance use begins. I was a product of the DARE program. We basically, the only thing I was shown was an egg in a frying pan. Basically, don't do drugs. That was the entire education, the entire message. And if you did, you were a person without morals, not a person with an illness. So I think by reaching out and educating students younger, the earlier the exposure, the better. I'm in rural Appalachia, where my family still remains. Nearly 1/3 of my high school graduating class is dead from opioid overdose or some complication thereof.
Wow.
And the poverty is palpable. The devastation there is palpable. And there's a generation that feels there's no way out. So I think in some of these hardest hit areas, we've got to get in there and show these kids that it's possible. It's possible to get out. It's possible if your parents have passed away. It's possible if your parents are in the criminal justice system. There's still an opportunity for you. And then I think it empowers them when we involve the youth. Again, instead of employing a paternalistic approach.
Absolutely. That's such great advice. I'm going to do another little intro, and then Lori, if you want to respond to this. While we know that the disease of addiction does not discriminate, it's no secret it can disproportionately affect certain populations more than others based on geographic barriers, lack of, okay, there we go. Technology, love it. Hopefully everything's going here. So it's no secret that can disproportionately affect certain populations more than others based on geographic barriers, lack of adequate services, and disparities in insurance coverage. In North Dakota, we have a sizable Native American population. And the data from the National Survey on Drug Use and Health shows that substance dependence or abuse is the highest among this group, among Native Americans at 15%. This further is complicated by high rates of poverty, lower life expectancy, increased risks of disease, and challenges accessing quality healthcare. We continue to find ways to collaborate with tribal governments in our state to provide support and solutions. In what ways have you have you sought to promote equity and recovery support? And what impact does this have related to the shame and stigma disadvantaged populations face when accessing care?
Thank you, Catherine. That's a big question. However, I do know that at LDA, we try to be diverse, equitable, and inclusive in our approach to recovery. It's no secret that there are disparities in access to care. That has been an ongoing issue. I know it is a huge problem in the African American community, where traditionally addiction has been criminalized rather than treated. So then you get into layers of stigma. You know, you have these layers of stigma that it almost seems impossible to climb out from under. That's why it's so important that I put a face and a voice on recovery, and that I provide living proof, not just at the recovery level, but culturally as well. And absolutely, my Indigenous brothers and sisters that suffer from rampant rates of alcoholism and mental health issues and other things. There's other issues that are going on as well. And so part of the solution that I see is that when you come to the table, you bring the leaders from those communities, the recovery community, place them in leadership roles. They're not just backfill after the agenda is already predetermined. Let's make sure that they're part of the decision-making process, because there's a myth among folk that say that the recovery community does not know how to act in its best interest. And that is not true. You get those leaders from the tribes. You get the leaders from your faith communities, from your various pathways to the table, so that then they have an authentic voice about what's really going on with that community. You can't come from the outside in and think you're going to solve internal things. Some things have to start internally. And so having value for the leadership of those within the recovery community that can be change makers within those places, the Native American people, the African American people, the LGBTQ folks, those folks that are using MAT and stigmatized. You get the leaders that are doing it the right way. When I say the right way, they're recovering. They're recovering. They're in the recovery process. When you bring those people to the forefront, you create this dynamic where people are more apt to lead. And there again, the power of peers. Thank you.
Absolutely. Great stuff. Well, this has been super informative. Lori and Melissa, you are both heroes out there doing incredible work in the community and across the nation. And I just want to say thank you so much for being courageous faces and voices of recovery, and for all the work you do to help eliminate stigma and foster supportive cultures for recovery. Lived experience with addiction and being able to share personal stories of finding the road to recovery is one of the most powerful tools we have to end stigma. So as all of you continue today through these sessions and the opportunities for learning and growth throughout the day, think about the ways in which you all can help move the needle on stigma. Whether you've struggled with this disease personally, or someone close to you has, or someone you care for on a daily basis is impacted, keep sharing your stories. Eliminating stigma does not only create opportunities for people to reach out and find help, it saves lives. Thank you to everyone who watched this session, and I will now turn it over to Richard to share some more information to you all as we move on to the next session. Thank you so much.
Thank you so much, First Lady Burgum, Lori, Melissa, for that incredibly impactful and important opening session.